Hi, my name is Marisa Nally, and I am a patient at Lutheran General Hospital. I was born with aortic stenosis and a bicuspid valve, so that means that my aortic valve was narrowed from birth in my heart, and I have been treated through Advocate hospitals. I have had 3 open heart surgeries. I was 9, 13, and 17, and 2 cardiac caths where they go through a vein and an artery in your leg up to your heart to try to open up my heart valves. 2 of the procedures I had were actual valve replacements. When I was 13, I had a Ross procedure where they take out your aortic valve, they put your pulmonary valve in the aortic spot, and then you had a human donor valve placed in the pulmonary spot. And then 5 years later, I had to have that replaced. When I was 17, the human donor valve replaced with a bovine pericardial valve. So it's the tissue from around a cow's heart fashioned into a heart valve around a metal ring. The care that I received truly influenced my desire later on to become a nurse, and now I'm actually working at Lutheran General as a nurse on the cardiac floor. I've been followed up every 6 months through my cardiologist, Dr. Dubrow at Lutheran General, and recently, within the last few years, they have had the opportunity to start up an adult congenital heart clinic, which has been wonderful for patients like me who are transitioning from pediatrics to adult. I'm 23, so I fall into that funny category where the pediatric cardiologists don't really know what to do with us, and the adult cardiologist, you know, the stuff that we would be encountering later on in life are related to our cardiac defect that we were born with.
When Marisa was in high school, she came to the clinic and she talked to me about what she was going to do, and she wanted to go to college to become a nurse. So she went to college, she was in nursing school, and she called me and she asked me if she could spend a couple days with me to shadow me and see what I did as my role as an advanced practice nurse. So we went to the clinic, she came to the operating room, she saw a lot of different things in my role, and she really enjoyed it. She talked to the patient, she talked to the families. She's a really energetic, a really compassionate person. They really enjoyed meeting her, and I think she enjoyed her experience. During one of her visits, she told me she'd applied at Lutheran General, and she actually got a position here, and she's now a nurse on the cardiac unit at Lutheran General. She's an excellent nurse. She has very good skills, and her patients and the families really enjoy her.